The killing of a fetus is called feticide. The killing of a neonate or a newborn is called neonaticide, which as per Knight is within 24 hours of birth and as per Reddy is within 4 weeks after birth. And the killing of an infant is called infanticide, that is killing a child in its first year of life. And finally, the killing of a child is child murder. If any one of these, feticide, neonaticide, infanticide, or child murder, is committed by the child's own parent, then that is filicide. The type of relationship between the parent and the child can be biological, or adopted, or step. For example, if a stepfather kills his daughter, that's filicide. If a mother kills her biological son, that is filicide. But if a random stranger kills a child, that's child murder. Okay. The total duration of gestation is 9 months. You all know that. That is the total period the fetus stays inside the womb of the mother is 9 months. Now, during this gestational period, during this time of gestation, a time comes after which, if the child is given birth to, there is a high chance the child will survive. There is increased chance of survival. But before which, if the child is given birth to, there is a very less chance of survival. And this particular point in time in gestation is referred to as the period of viability, which is normally considered to be around 28 weeks. So basically, let's say a woman is pregnant with her baby. If she gives birth to this baby after 28 weeks of gestation, there is a high chance the child will be born alive. But if this mother gives birth to this baby before 28 weeks of gestation, there is a very high chance the child will be born dead. So viability is nothing but that point in gestation after which the child is able to live independently out of the mother's womb, out of mother's uterus, but before which the child cannot live independently out of the mother's womb, out of the uterus, because the child is not developed enough to live an independent life outside the uterus of the mother. Talking about the status at birth. See, at birth there are only two possibilities. Either the child that is given birth to is alive, or the child that is given birth to is dead. If the child is alive, we call this live birth. On the other hand, if the child is dead, there are two possibilities. Either the child was already dead in the uterus before birth, then that is deadborn, or the child was not dead in the uterus, it was alive but passed away during delivery, then that is stillbirth. Okay, let me give you the definition of it, because at the end of the day, that's what you need. So first, you have live birth. What is live birth? Live birth is when birth of a baby takes place after viability. Pretty obvious, because before viability, the child is going to be dead anyway. Before viability, the child is not developed enough to stay alive outside the uterus of the mother. So it is only when birth of the child is given after viability and the child shows signs of life. What are the signs of life? Array, what do you want to see in a newborn baby so that you are assured the baby is alive? You want to see for this triad. You want to make sure that the baby is crying, that the baby is moving, and that the baby is breathing. If the baby is not crying, the baby is not moving, the baby is not breathing, that's red flag sign. The baby might be dead. And that is exactly what stillbirth is. What is stillbirth? Stillbirth is when the birth of the baby, the birth of the baby takes place after viability, because again, before viability, the child is not developed enough to survive independently out of the mother's womb. So birth is given after viability, after 28 weeks, but the child shows no signs of life. The child is not crying, the child is not breathing, and the child is not moving. And finally, what is deadborn? Deadborn is when the child, or shall I say the fetus, was already dead inside the uterus of the mother even before delivery. Deadborn is when the fetus was dead inside the womb itself. Stillbirth is when the fetus was alive inside the womb, but during the time of delivery, the baby passed away. Okay, so I said that the crying takes place after birth when the child is alive. But there are two conditions when crying can take place even before birth. They are vagitus vaginalis and vagitus uterinus. See, the name says itself. Vagitus vaginalis is when the cry of the baby is heard when the baby is in the vagina itself, from the vagina itself. And vagitus uterus is when the cry of the baby is heard when the baby is in the uterus itself. So there are two exceptional cases. With that being said, now what you need to know from exam point of view, is number one, the features of a deadborn. But before that, let me revise you what I have taught you till now. I have just taught you few definitions. The killing of a fetus is feticide. The killing of a neonate or a newborn is neonaticide, which as per Knights is within 24 hours of birth and as per Reddy is within 4 weeks of birth. The killing of an infant, that is within the first year of life, is infanticide, and the killing of a child is child murder. If any one of these are being committed by the parent of the child itself, that is filicide. Viability is that period in time, that point in time in gestation, after which the child is able to survive independently out of the womb of the mother, but before which the child is not able to survive independently out of the womb of the mother. As per world record, the minimum gestation period at which a child was given birth to and the child was alive is 21 weeks and 1 day. 21 weeks and 1 day. This is an exceptional case. At this time period in gestation, if the baby is given birth to, it is not going to be alive. It is not developed enough to live independently out of mother's womb. But this is an exceptional case. That is why it holds the Guinness World Record. The status of birth is at birth is either the baby is alive at the time of birth or dead at the time of birth. What is live birth? Live birth is when the baby is given birth to after viability and it shows signs of life. The signs of life are crying, breathing, and moving. Stillbirth is when the birth is given after viability but the baby shows no signs of life. That is, the baby is not crying, the baby is not moving, the baby is not respiring. Deadborn is when the baby was already dead in the uterus itself way before delivery. Vagitus vaginalis and uterinus is the cry of the baby heard from the vagina and uterus respectively. Okay. Acts of omission versus acts of commission. What is this? See, the killing of an infant is infanticide, but you may kill an infant in two ways. Number one, by committing something on that child, which is acts of commission, and number two, by not doing something that you need to do for the child, that is acts of commission. So as a parent, as a caregiver, as a guardian, you might commit something on the child which leads to the death of the child, that is acts of commission. Or you might not do something on the child that you need to do for the survival of the child, that is acts of omission. What are acts of commission? Every way you can kill a child are acts of commission. You can strangulate a child, strangulation. You can suffocate a child, suffocation. You may drown a child, drowning. You may inflict injury on the child, hit a child on the head, causing head injury and then convulsion and then coma. Or you may poison a child. act of inducing toxins. You may strike a child, beat a child, inflict physical injuries on a child. You might push a child off a cliff. These are all acts of commission. You are committing crimes here. Acts of omission would be things that you fail to do. So failure to clear airway of the child after birth. So this is something that as a caregiver you need to do, but you are unable to do. Acts of omission. Failure to feed your child. Feed your child. Act of omission. Failure to protect the child from heat and cold. Heat and cold. That's your responsibility. You are not fulfilling your responsibility, or you are neglecting your responsibilities. And all acts of neglect, they come under acts of omission. Okay. Now, what are the features that you can appreciate in a deadborn? That is, the fetus was already dead inside the uterus, and the mother now delivers this deadborn. What are the features that you can appreciate in this fetus after it is given birth to, or before it is given birth to in the womb itself? So I have divided that into two. There are physical features that you can appreciate, and there are radiological features that you can appreciate. There are altogether 3 physical features that you need to know. 1, 2, 3. Number 1 is rigor mortis at birth. Number 2 is maceration. And number 3 is mummification. Number 1 is rigor mortis at birth itself, at delivery itself. See, the maximum time taken for rigor mortis to onset, or shall I say the average time, the average time it takes for rigor mortis to onset in a dead body is 60 minutes. So if you are able to appreciate rigor mortis in a newly born child, that means the child was already dead in the uterus itself. Or you can only appreciate rigor mortis in a child, in a newborn, only if it was already dead in the uterus. So it's a clear sign. Rigor mortis at birth is a clear sign that the child was already dead while it was in the uterus, while it was a fetus in the uterus of the mother itself. And since it was already dead, you were able to appreciate it as soon as it came out of the uterus. Number 2 is maceration. See, what is deadborn? Deadborn is the child, the fetus is already dead in the uterus itself. So after death, what follows? Decomposition of the dead body follows. And there are 2 ways decomposition can take place. I have already taught you that under the topic of thanatology and postmortem changes. If decomposition takes place on its own, that is autolysis. If decomposition takes place with the help of bacteria, that is putrefaction. Maceration is autolysis of deadborn. Maceration is autolysis of deadborn. How does it take place? This is how it takes place. So what you have is a dead fetus in the uterus. This dead fetus is inside of an intact amniotic sac. This intact amniotic sac contains lots of amniotic fluid. This amniotic fluid is responsible for aseptic autolysis, and this is referred to as maceration. But let's say due to some reason the intact sac ruptures. The intact sac ruptures and there is entry of air. Entry of air. Before there was no air inside the amniotic sac, but now due to some reason, due to the rupture in the amniotic sac, there is entry of air inside the amniotic sac. Then instead of aseptic autolysis or maceration, putrefaction takes place. Good? Good. Now, depending on how long the fetus was dead inside the uterus of the mother, the various physical changes or characteristics of maceration can be appreciated in the dead child. This is what I mean. So there are three different times. If the fetus was dead in the uterus for at least 12 hours, then reddening and peeling of skin is seen. If the fetus was dead already for at least 1 day, then blebs and blisters in the skin is seen, plus abdominal distension is seen. If the fetus was already dead inside the uterus for at least 2 days, then the body of the fetus becomes flaccid. See, after death, there is loss of tone of muscle. So the body becomes completely flaccid. That is, if you keep this newborn, the deadborn, on a flat table, it is going to be completely flat. There are not going to be any curvatures because there is no tone of the muscle. The body is just will just plop on the flat surface. The joints are hypermobile. That is, if you try to move the joints, it will move in all directions irrespective of the type of joint. Plus, there's going to be unpleasant sweet smell. Unpleasant sweet smell. Let me show you with the help of a picture right here. Okay. See, this is a deadborn. This child was already dead inside the uterus of the mother because the process of maceration has taken place in the child. See, you can appreciate the reddening of the skin as well as the peeling of the skin. You can appreciate the abdominal distension. Plus, you can also appreciate the hypermobility of the joint. The joint is moving in all directions irrespective of the type of the joint. And the body is completely flaccid. There is no tone in the body of the child. That means you can clearly say that this child was dead inside the uterus of the mother for at least 2 days. For at least 2 days, the child was already dead inside the uterus of the mother. Okay. The third and final is mummification. Okay, this requires a special condition, and that is, so there is a dead fetus inside the uterus of the mother. Now, there's intact amniotic sac with very little or no amniotic fluid. Very little or no amniotic fluid. So there's no fluid to hydrate the fetus. As a result, the process of dehydration is faster than the process of decomposition. And whenever the process of dehydration is faster than the process of decomposition, mummification takes place. So those are the three physical characteristics that you can appreciate in a deadborn. Number one is rigor mortis as birth. Number two is maceration. In maceration, if the death has taken place in the uterus of the mother for at least 12 hours, you can appreciate reddening and peeling of the skin. If the death has taken place for at least 1 day, you can appreciate blebs, blisters, and abdominal distension. And if the death has taken place for at least 2 days, then the body is completely flaccid, joints are hypermobile, and there's a sweet smell coming out of the body of the fetus. The process of maceration takes place due to aseptic autolysis carried out by the amniotic fluid. Mummification takes place when dehydration is faster than decomposition. That is only possible when there is little to no amniotic fluid. Okay, what about the radiological features? First, I'll explain you the various signs that you can appreciate. Then I'll give you practice question for radiological features along with the radiology itself. Okay, for now, just try to mug up the names of those signs. Okay, these are the radiological features you can appreciate. Number one is none other than double halo sign. What is double halo sign? So, in double halo sign, the fetus is already dead inside the uterus of the mother. You carry out USG and you will be able to see too hollow in the USC. This is because there is collection of edema fluid in between the skull and the scalp. Due to the collection of edema fluid in between, the two layers, they separate. Okay, so that is the double halo sign. The second is Spaulding sign. After death, shrinkage of the brain takes place and liquefaction of the brain takes place. As a result, the joint in between the skull bones becomes unstable and they slip over or they slide over one another. This is called Spaulding sign. This is seen at least 4 to 7 days after death of the fetus inside the uterus of the mother. Number 3 is Robert sign, which is nothing but the collection of gas inside heart and great vessels. Number 4 is overcrowding of the ribs. After death, there is collapse of the lung and the ribs, they come close to one another. So there is overcrowding of the ribs. And finally, there is ball sign. See, after death, there is loss of tone from the body of the dead fetus, plus the vertebra, they collapse over one another. As a result, the spine hyperflexes and the body of the fetus curls into a ball. That is why it's called ball sign. It is due to hyperflexion of the spine. So you have the double halo sign, Spaulding sign, Robert sign, overcrowding of ribs, and ball sign. Time for revision. Obviously, I'm not going to leave you without the photos. Okay, so what is this? You can see that this right here is the skull vault and this right here is the scalp. And in between the skull vault and scalp, there is deposition or collection of edema fluid separating the two layers apart. And that is why they look like two halo in the USC, referred to as a double halo sign. Second, due to the shrinkage of the brain and liquefactive necrosis, the bones of the skull have slid over one another. And this is referred to as the Spaulding sign, which is seen 4 to 7 hours after the death of the fetus inside the uterus of the mother. Here you can see there is collection of air inside heart and the great vessels. This is Robert sign, which is seen 12 hours after the death of the fetus inside the uterus of the mother. You can see that the ribs have come close to one another due to the collapse of the lung after death. This is referred to as the overcrowding of the ribs. And finally, what is this? This is the X-ray of a pregnant mother. This is the pelvis of the mother, but inside the skeleton, you can see another skeleton. This right here is a skull, and then here's the spine. This is the skeleton of the baby inside the womb of the mother. You can see that the spine is hyperflexed. Sometimes you can appreciate that the neck is hyperextended, but here the spine is hyperflexed and the baby is curled up into a ball. This is because after death, there is loss of tone from the body, plus the vertebra, they collapse over one another and the spine hyperflexes and the baby curls up into a ball. So one last revision. What is this? This is double halo sign. What is this? This is Spaulding sign, which is seen 4 to 7 days after the death of the fetus. What is this? Overcrowding of the rib. What is this? Collection of gas inside heart and great vessels, referred to as Robert sign, which is seen 12 hours after death of the fetus. And what is this? Hyperflexion resulting in ball sign. Okay, so that's dead one for you, right? Okay, next. A very popular question from both entrance and university paper point of view, and that is for you to be able to differentiate between stillbirth and live birth. See, as an autopsy expert, when you are brought with the case of infanticide, it becomes your duty to determine whether the infant was already dead at the time of delivery, that is stillbirth, or the infant was alive at the time of delivery and it was killed later on, right? Because being able to differentiate between these two conditions, whether the child was stillbirth, that is it was already dead at the time of delivery, or the child was live birth, that is the child was alive at the time of delivery but died later on in life. Being able to differentiate between these two is a very important medico-legal significance from legal point of view that you need to present in the court. So as a medical expert, forensic expert, how can you differentiate between the two? There are many ways you can differentiate between the two, from external physical features to characteristics of individual organs, but we are going to focus deeply on one single organ, and that is your lung. Okay, so let's look at the differences in the lung in between stillbirth and live birth. So first you have your stillbirth, and next you have your live birth. All differences, and I repeat, all differences are based on only one logic, and that is, if it was a stillbirth, that is, the baby was dead at the time of delivery itself. That means the baby was never able to respire or inhale air in. So that the type of lung present in stillbirth is unrespired lung. If it was a live birth, that means the baby was alive at the time of birth. That means the baby was able to inhale air in. Respiration was there. That is one of the signs of life. Respiration was there. That means the lung contains air. The lung is respired. There is a respired lung. All you need to do is apply various methods to differentiate between unrespired lung and respired lung. Then you can eventually determine whether the case of infanticide is that of a stillbirth or a live birth. First is the level of diaphragm. In order to appreciate the level of diaphragm, you first need to cut open the abdominal cavity and then insert your hand inside and then feel for the diaphragm and see exactly at what level is the diaphragm. If it's an unrespired lung, that is, the lung does not contain air, the lung is going to be collapsed and small, and the diaphragm is going to be at a higher level, that is around 4th, 5th rib. But if it is a case of respired lung, that means there is inflation of the lung as it gets filled with air, and the diaphragm is pushed downward. So it is at a level of 6th, 7th rib. Difference number 2 is the weight of lung, also referred to as the Fodor's or the static test. Remember, Fodor's or the static test. The unrespired lung does not contain air, but it also does not contain blood. That is, there is no ventilation and no perfusion. So it is relatively lighter at around 30 grams. But respired lung, it contains air and blood. There is ventilation as well as perfusion. So it is around double the weight, 60 grams. Third is weight of lung to weight of fetus. This is referred to as PLOUCQUET', Plocquet's test. What? Plocquet's test. In unrespired lung of a stillbirth, the ratio is 1:70. In a respired lung, the weight of lung is times 2. So you multiply by 2, you get 1:35. Difference number 4. Flotation of lung. Flotation of lung. This is given by hydrostatic test or Regat's test. Unrespired lung does not contain air, so it is denser than water. So if you put this lung in a container with water, it will sink. Respired lung contains air, so it is lighter than water. So if you put this lung in a container with water, it will float. Number 5 is Redden's middle ear test. In stillbirth, there is gelatinous substance in the middle ear, gelatinous substance. But in live birth, since the process of respiration has taken place, in order to balance the pressure that is the atmospheric pressure and the pressure inside. The eustachian tube opens and the gelatinous substance it falls through the eustachian tube. So there is no gelatinous substance in the middle ear. I repeat, in live birth, due to respiration, there is opening of the eustachian tube and the gelatinous substance from the middle ear falls through the gelatinous tube. So there is no longer any gelatinous substance in the middle ear. Number 6 is Bracelaw's second life test. See, after respiration, the air does not just enter the lungs, it also enters the stomach. So you can simply check whether there is air in the stomach or not to determine whether it was an unrespired lung or a respired lung to differentiate between stillbirth and live birth. For that, you separate the stomach from the fetus by ligating it and then put the stomach in a ball containing water. You do the same for 2 specimens. Then you put a puncture inside water in the stomach. Put a puncture inside water in the stomach. If it is stillbirth, there is no air in stomach. So there will be no bubbles coming out of the water. But if it is a live birth, that means there is air in stomach. So what will come out of the water? Air bubbles will come out of the water. So those are the differences between stillbirth and live birth, all on the basis of your lung. Difference between unrespired lung in stillbirth and respired lung in live birth. Number 1 was level of diaphragm, which is around 4th, 5th rib in stillbirth and 6th, 7th rib in live birth. Second was Fodor's test or static test, where the weight of the lung is 30 grams in stillbirth and 60 grams double in live birth. Then next is Plockett's test, that is the weight of the lung to weight of the fetus is 1:70 in stillbirth and double that 1:35 in live birth. Then fourth is hydrostatic or Regat's test, that is the lung sinks in water in stillbirth but it floats in water in live birth. And there's Redin's middle ear test, that is there is gelatinous substance in middle ear in stillbirth, there is no gelatinous substance in middle ear in live birth. And finally there's Bracelaw's second life test, that gives you that there is no air in stomach in stillbirth but there is air in stomach in live birth. Out of all these, you need to know the flotation of lung by hydrostatic or Regat test in detail. So let's learn about that. So hydrostatic test in detail. So you take a container. This container contains water. To this container, you put not the lung but the liver. You take a piece of liver from the dead fetus and then put it in this container of water. If the liver sinks, then you can continue with the test. But if the liver floats, then you cannot continue with the test. That is because the process of decomposition has already started. And you know that decomposition results in gas production. So the lungs are gonna be filled with gas from decomposition itself. So you won't be able to separate whether air due to respiration was there in lung or not, because it is already filled with gas from decomposition. So only when liver sinks, that means decomposition has not started. That is, the liver does not contain the gas produced from decomposition, and that means you can continue with the test. So after liver, to the same container, you are going to put in the lung. So you're going to ligate the lung and then put in the lung. Let's say the lung floats. Then what you do? Now you make pieces of the same lung. You make tiny pieces of the same lung and then put it in the same container. You make pieces of the same lung and then put it in the same container. Now there are two possibilities. Either these pieces, they are gonna sink. If they sink, that means there was no air in lung. That means it was an unrespired lung, which is present in, where is it present? It is present in stillbirth. But if these pieces, they float, they float. That means there was air in lung. It was a respired lung, which is found in, it is found in live birth. So now you have differentiated between stillbirth and live birth. But you can go one step further. You can differentiate whether in live birth the baby was able to take complete respiration or incomplete respiration. For that, what you simply do is squeeze. You squeeze the lung pieces to remove tidal volume. So you take the same lung pieces, you squeeze them to remove the tidal volume from them. And then there are two possibilities. If the lungs, they sink, that means there is no residual volume inside the lung and it was an incomplete respiration. But if the lung pieces, they float, that means there is a residual volume inside the lung and complete respiration took place. So complete respiration is when there is residual volume inside, not just tidal volume. So that is your hydrostatic test or flotation test. Let me revise one more time. First, in a container with water, you put a piece of liver from the dead fetus, from the dead baby. If the liver sinks, you can continue with the test. But if the liver floats, that means the process of decomposition has already started. There is already gas production. You can't continue with the test. If the liver sinks, you continue, you put in the lung. If the lung floats, you further continue, you cut the lung into small pieces and then put those pieces in the same container with water. If those pieces contains air, they are gonna float. And if they are gonna float, that means it is a respired lung, which is present in live birth. But if those pieces, they sink, that means there is no air in lung. It was an unrespired lung, which is present in stillbirth. Now further you can continue to differentiate between complete and incomplete respiration. You squeeze out those pieces, remove tidal volume and then put them back in the same container with water. If they float, that means there is a residual volume inside and there was complete respiration. If they sink, that means there was no residual volume inside and it was a case of incomplete respiration. What are the conditions where hydrostatic test can come out to be false positive or false negative? So I have already told you one condition where it can come false positive, and that is decomposition, because in decomposition there is gas production. The lung is going to be filled with gas. So even if it was a stillbirth, an unrespired lung, it would float due to the gas produced from decomposition. False negative is seen in consolidation. Let's say it was a live birth. The child was able to breathe in air, but the lung was consolidated by pneumonia. Then the air spaces is filled with inflammatory fluid. So the lung is going to be dense and it is going to sink in water. So false positive in decomposition due to gas production filling up the lungs, and false negative in consolidation where the air spaces are filled with inflammatory fluid, even though it was a case of, it could have been a case of live birth. So with that, we are done with infanticide. So what did we learn under infanticide? We learned what is feticide, neonaticide, infanticide, child murder and filicide. We learned what is viability. We learned the difference between deadborn, stillborn and liveborn. We learned about vesitus vaginalis, vesitus uterinus, acts of commission, acts of omission, about the physical features and radiological features in a deadborn, and then the differences between stillbirth and live birth, and finally hydrostatic test in detail. All right.